The issue is less the way in which it's organised and more the amount of resource that there is that the health and social care system's going to absorb from the public purse. And I'm very uncertain about the capacity of the system to sustain the kind of costs that one predicts coming through in both cases. So I think I wouldn't say that the current arrangements are fading, but I think there will be a huge challenge for maintaining a fully tax-funded NHS, and as we know from the whole Dilnot business, we do need to make some significant changes to the funding of social care. I think that tax funding is generally, not only emotionally, sort of psychologically, in terms of a societal decision, a good thing. It's also probably most efficient because the collection costs are wrapped up in the general collection costs. There aren't all the transactional issues that you have with all the other forms of funding. So as far as the NHS is concerned, I would strongly hope that we could maintain tax funding and free care at the point of delivery. Whether that will be, the question is then, what do you do with that money? It's not whether that's the best way or there are other ways of raising that money. I think in the social care system, it's more complicated, isn't it? Because we start from a base in which a lot of people are paying. And I've got an elderly mother. I recognise that I think families probably are going to have to take on rather more responsibility than has been the case up to now. Those differences are really difficult to bridge at the moment. There's no question about it. Different funding streams, different financial settlement, different accountabilities, all of these things mean that if you want to integrate care between social care and the NHS, you have to deal with some extremely complex local issues. So if you think of things in neat boxes, yes, it would be a wonderful solution to do away with those distinct silos and combine them into one. Whether that's politically possible, I think, is really hard to tell. You'd have to either put the health service into local hands, or do the reverse and put the social care into central government hands. And my guess is that either or both of those is going to be too much politically. So I'd like to think that it was possible, and there may be ways in which you can, over time, bring them closer together, but I don't see a clear strategy at the moment.